following whiteboard video will provide you with important information in a question-answer format regarding neonatal abstinence syndrome, otherwise known as NAS. Question 1. What is NAS? NAS is a withdrawal syndrome seen in infants with exposure to drugs. Signs and symptoms of NAS include high-pitched cry, poor sleep, hyperactive reflexes, tremors, skin abrasions from constant rubbing, sweating, high temperature, frequent yawning or sneezing, nasal stuffiness, poor feeding, vomiting, diarrhea, and even seizures. Question 2. How often does NAS occur? Recent studies reveal NAS occurs in approximately 50% of births in patients receiving medication-assisted treatment with methadone or buprenorphine. Question 3. Will a lower daily dose of medication decrease the chances of a baby having NAS? Quite simply, no. Several recent studies show there is no relationship between severity of symptoms and maintenance medication dose. Please don't feel the need to taper your dose thinking your baby will not experience withdrawal. This is very unsafe. Your instability and withdrawal symptoms may be stressful for your baby and can cause severe complications including premature delivery or even neonatal death. It is very common to have to increase your dose of methadone or buprenorphine throughout your pregnancy as your baby grows to avoid withdrawal symptoms. There's also recent research linking genetics to the presentation of NAS. Question 4. What other drugs or medications have an effect on NAS? Most substances that have a property of dependence can cause NAS and make symptoms worse. This includes nicotine, alcohol, cannabis, and benzodiazepines such as Xanax, Valium, or Ativan. Studies have also shown some serotonin reuptake inhibitors, also known as SSRIs, are medications used to treat major depression and anxiety disorders can exacerbate NAS. Question 5. When do symptoms of NAS usually begin? On average, babies of women receiving MAT with methadone or buprenorphine have symptoms within 4 days, but on some rare occasions, symptoms can start 1 to 2 weeks after birth. Question 6. Does NAS have a long-term effect on children? There is a lot of conflicting research about the long-term effects of NAS. Currently, there are no high-quality studies with large patient samples to draw any solid conclusions. Most children meet developmental milestones, but there are also some associations with opioid exposure and behavioral problems. Again, the scientific connections are not strong enough to speak with certainty about the long-term effects. In summary, not every baby exposed to methadone or buprenorphine goes through NAS, but if it happens, we want you to be prepared. Watching your child go through NAS is rough. As a mother, it's common to feel extremely guilty, further stigmatized, and helpless. Parts 2 and 3 of this whiteboard series will take you through how hospital professionals assess and treat babies with NAS and what you can do to help. Together, we can try to make this experience better for you, your baby, and all healthcare professionals involved.